Hello, everyone, and welcome. My name is Melissa Favela. I am the community educator for Southern Caregiver Resource Center, where we care for those who care for others. Today, I bring you a very special topic. The reason that we bring you this topic today is because September is Fall Prevention Month or Fall Awareness Month. So that is why we bring you this topic today of steps to a safer home, fall prevention strategies for caregivers. So if you're a caregiver, if you live on your own, if you are a person who walks around their home outside, then you can get information from this presentation. This presentation is for everyone, and of course, especially for those caregivers. So get comfortable, grab a notepad, a pen, and feel free to take notes. So let's get started. So our learning objectives for today will be just learn how to prevent falls in the home, right? If you learn how to prevent one thing, if you learn something new today, that is the main takeaway that we would love for you to have. Identify potential risk factors. So what is the risk factor for falling at your home or at your care receiver's home? Plan how to have a conversation to keep your loved one saved or the person that you care for is saved. Sometimes we don't really know how to approach the conversation, or sometimes people are defensive. So we'll talk about that. We will talk about developing a plan of action to prevent falls and implement safety methods. Next slide, please. So, why is it important to prevent a fall? Well, because falls are the leading cause of fatal and non-fatal injuries for older Americans. 1 in 4 older adults actually fall every year. And even if they're minor falls, these minor falls can end up causing big issues, big trouble, and also this adds to medical expenses. Falls can be a very big medical cost that is not necessarily anticipated. So, as you see here from the image, in 2018, there were 52 million people that were considered older adults. So, older adults is 65 and older, out of which there were reported, and these are just the reported ones, 36 million falls in 2018 at a national level, out of which 8 million resulted in injuries. Now, the projected growth of older adults by 2030 is that they're going to be double the people who are 65 and older. So the projected amount of falls and the importance of fall prevention is that by 2030, there will be approximately 73 million people who are considered to be older adults. So, again, 65 and older. And the projection is that there will be 52 million falls that are reported, out of which 12 million result in injuries. So again, this image really just highlights the importance of fall prevention and talking about it. And additionally, over 10,000 people turn 65 every day in the United States. So of course, the more people we have who are 65 and older, which is when technically we're a little bit more prone to falling, then the more falls we might have and the more really prevention strategies we might have to take into consideration. Now, additionally to these statistics, death rates from falls have actually increased to about 30% within the last decade. And some people tell me, well, Melissa, my loved one had a small fall, they just hurt their knee or they fractured a bone. Well, sure, but that fractured bone can actually cause big issues that can lead to death. So it is important to not minimize the falls that people can take, and always report it, go to a doctor. So it is important to pay attention. And of course, hopefully they haven't happened, but to prevent falls. Next slide, please. So let's now that we know the statistics, now we know why it's important to talk about this. Let's think of a time where you almost fell, or a time where the person that you care for almost fell, right? This can happen anywhere. Maybe you felt a little drowsy after taking medication. Maybe you didn't calculate the height of the toilet too well, and then it was kind of a long way to sitting on the toilet. Maybe there wasn't enough lighting in the room or the hallway where you were walking, or even outside, right? Sometimes the sidewalks can be a little tricky. Um, there are cracks sometimes when we're outside in our backyard, in our front yard. So these are all examples of everyday activities that we may do, or the people that we care for may do, that can lead to falls. So again, we are prone to falls every day. So both the caregiver and the care receiver need to be aware of this risk. Next slide, please. So, who can prevent falls? You can prevent falls. We can all prevent falls, and we can protect ourselves and those we care for by learning a few tips and maybe what to look for. Next slide, please. So, the first thing we got to do, now that we know why it's important, now that we know that everybody is at risk, now we have to identify the risk factors. And this will help you feel a little bit less overwhelmed as to where you or the person that you are caring for might be at risk for a fall. So, there are risk factors that are physical. The other ones would be lifestyle and behavioral. And then we have environmental. And we will go into these more specifically, right? So let's go on to the next slide, please, to talk about the physical risk factors. So, a physical risk factor, and I already mentioned this, is age, right? Technically, when people turn 65 and older, statistically, they are more prone to fall. So, age is considered a physical risk factor. Also, cognitive impairment. Cognitive impairment is considered a physical risk factor because maybe if a person is unable to coordinate their limbs correctly, then that is a fall risk. Also, physical disability, right? If we have a person that suffered a stroke and maybe they're not able to move, one side of their body, maybe one of their feet are dragging. So that is a physical disability, or at least a mobility issue that can be a fall risk in anybody's home, inside or outside. Poor hearing and vision. A lot of people tell me, well, what does hearing have to do with any of it? Right? With falling, vision, seems a little bit more obvious. But, with listening, with hearing, it's very important because sometimes people tell, their care receivers, I'm going to put this chair by you, be careful. Right? Or you're walking too close to the stove, it's still hot. So if the care receiver is not listening to those messages, they're not hearing, then they are at risk for tripping with the chair, for maybe touching the stove while it's hot, hurting themselves, and then also being at risk for a fall. So hearing is definitely very important, as well as vision. Impaired balance and posture. This can happen again with older age. Maybe our agility has decreased, maybe because we have medications or we have other issues that can cause an imbalance, right? So these are also considered physical risk factors. And the use of medications. Of course, not every medication is going to have a side effect that puts us at risk for falling. However, there are medications that do cause that. So it is important that if you are ever prescribed a medication, and you're 65 and older, and even if you aren't, but especially if you're 65 and older, talk to your physician and ask them if it'll have any side effects that might cause dizziness or impaired vision that could cause a fall. Or if you're not taking medication, but the person that you are caring for is taking medication, let's ask their primary care provider if any side effect will place them at a risk for falling. This is very important, besides, of course, other side effects. But again, today we are focusing on fall prevention. Next slide, please. So our next risk factor would be lifestyle and behavioral issues. So a lot of the times, it's not necessarily that the person has already fallen and they're afraid to fall again. Sometimes they have. They become fearful after a fall. And so this causes for them to really restrict how they move, how much they move. And you might think, well, Melissa, they're being extra careful. This is actually good. Well, sure, being careful is good, but some people are now fearful where they really don't want to move at all. But we know that we still have to move. If the person is able bodied, they still have to move, at least to take a shower, at least to use the restroom. So being fearful of falling and restricting their movements severely can actually place them at a higher risk for falling, right? Especially because if they're not getting enough movement, if their muscles start being deprived of that blood flow, of that oxygen, then they'll most likely become more clumsy and again be more prone to falling. So fear of falling is something that can actually be very detrimental and cause another fall. Risk-taking behavior is quite the opposite. I hear this one a lot. I see it a lot where people don't really feel that they should be careful with their movements. They feel vital and they feel able, which is wonderful. We all want to feel that way. But they also don't take into consideration their limits, their physical limits, right? So, how many of you have seen an older adult on a ladder trying to put maybe the Christmas lights up, right? When you're thinking, well, you know what, that is a big risk fall. Maybe they are taking medication that causes dizziness. Maybe just physically you can tell that they are having some movement issues. So really risk-taking behavior is a big one. And sometimes this is a bit more challenging to tackle and to discuss, but we will talk about how to discuss this type of behavior in the upcoming slides. But again, being aware and also checking in with yourself. If you are a caregiver, but you yourself are 65, maybe older, check in with yourself and think about, hey, you know what? Yes, am I placing myself at risk taking certain actions or doing certain things? So it is important to start acknowledging that. Not that you can't do things, but just minimize the risk by doing those things. Of course, poor nutrition and hydration. We have some people who are care receivers, and for whatever reason, maybe they have a condition where their nutrition is being affected, then they can become weaker, their muscles can become weaker, they can start having limitations, loss of energy, and that can put them at risk for a fall. Also, people who really didn't exercise, or maybe they didn't for some reason, they stopped exercising. The lack of movement, the lack of exercise does put us at risk for falling. And you might say, well, Melissa, if I go to the gym and, I'm on the treadmill or the elliptical, that might also be a risk factor. Well, sure. That's why we want to check our behavior and see if we're taking extra risks, because we might be going to the gym, being an older active adult and maybe, being on the treadmill at a sensible pace. that is minimizing our risk taking behavior, right? So, really, exercise is something that we do want to encourage, but we want to take into consideration any physical limitations that we may have, and of course, minimize that risk taking behavior. And I already mentioned medications. These are also considered a lifestyle risk factor. Next slide, please. Then we also have our environmental risk factors. So these are risks that may be inside, but also outside our home, right? These can include uneven floors or uneven ground, clutter, and clutter can be inside or outside the home, but clutter nonetheless, or environmental factors like the weather, right? Maybe it's raining, maybe it's icy, maybe, here in San Diego, we don't really have ice, right? But maybe you do live in a place where you do get ice. So, really, inside the home, watching out for unstable chairs, limited space. If we are caring for someone and we have furniture that is very close together, we might want to rearrange the room where we give more space to that person to move around freely. Maybe instead of having several furniture pieces for them to hold on to, maybe we actually want to look into installing handlebars, right? And we'll talk about that in a little bit more detail. Having limited lighting. And limited lighting can be natural light, but also, right now as we're heading into fall and winter, the days will become shorter. So we need to make sure that we have good lighting inside the home, but also outside the home if those that we are caring for are going outside to take out the trash on their walks, whatever it may be. Throw rugs, right? So those rugs that don't have the sticky bottom, right? They're not maybe attached to the floor. They can get very slippery. So these are definitely a risk to have in the home, really for anyone, right? I can say that I have been there in that that risk of falling with those throw rugs. And then clutter, as I mentioned, inside or outside the home, we really want to limit clutter, altogether, but especially on the floor, on those spaces where the person that we care for is moving around in. And then, of course, making sure that these steps, if there are steps in the home, if the person that we're caring for is going up and down the stairs, that the steps are safe, that there's a handrail, that there are no rugs on the steps. Also, if they're outside, watching out for possible cracks, right? Loud noises is something that people don't really take into consideration. But some people can become surprised and maybe stressed with loud noises. And so, if they're all of a sudden startled, this can cause a fall. So, again, anything that you might notice, it is important to check your surroundings and check the surroundings of where the care receiver lives and try to identify what may be a risk factor for them. Next slide, please. And something going off, and we will go much more into detail, but something kind of going into the risk factors is, as I mentioned, just being aware of the surroundings, finding those details to notice maybe where the risk is, moving with awareness, seeing if we're limiting the movement too much. And really, it's sometimes it's as simple. It sounds simple, but sometimes it's not. As being careful, slowing down, taking sensible steps to stay safe. Really, sometimes, when do we make mistakes? When we're stressed out, when we're in a hurry, right? So same thing with reducing the risk of falling, right? Slowing down, right? Taking sensible steps to staying safe. And, maybe for the person that you're caring for, using assistive devices to facilitate movement. And this might be something that we need to discuss with their primary care provider, or if there's already a movement specialist involved in their care, this might be something to bring up with them as well. Next slide, please. So, if you think that falls are not important, well, the CDC tells us otherwise, right? So they say falls aren't something that just happens when you age. There are proven ways to reduce falls. And this is something that I love to tell people. You're not supposed to fall, right? Falls are preventable. Of course, falls can happen, they can be accidental, but we can do our best to prevent them. So, what is something that we can do now that we know the statistics, now that we know some of the risk factors? Well, we can start the conversation with those around us. Maybe we have a group of friends that are 65 and older. Maybe we can start that conversation with the people that we're caring for that are 65 and older, or getting to that age, or have a condition where they're a little bit more prone to falling. So, next slide, please. So, something to recognize is that the conversation of fall prevention might be something that we need to keep going back to. It might not be something that is resolved right away. And of course, because if the person, their condition changes, and of course, the older they get, maybe the more likely they are to fall. It is a conversation that we're going to need to keep going back to, and that is okay. So, when we start a conversation, it is important to find a good space to do it, the appropriate time, to make sure that we are being considerate, that we are taking feelings into consideration. Sometimes for people, it's very hard to discuss a fall that they had, or even to consider that they are at risk for a fall. So, we will talk about how to start a conversation. So, besides prepping yourself, you can educate yourself, right? Making sure that you feel confident about discussing this topic, maybe already having some observations to make of, you know what, I did notice that your sidewalk was, it had some cracks, and I know you love to go out on walks. So let's talk about it, right? I feel like it's a little risky. We want to be considerate with our approach. We want to, again, make sure that we are choosing the right time as to when we're going to discuss this topic. And instead of saying, the you, and we'll go a little bit, we'll give some examples, but instead of saying you are older, you need to watch out how you walk, or you need to watch out where you walk, we can say, I am concerned for you. I noticed that, there's this chair in the living room. The other day I sat on it, and I thought it was wobbly. How about if we take a look at it? I'm concerned that you might sit on it and fall, right? So really considering how we approach the situation, being mindful of our tone, our body language, right? Again, it's very easy to especially if there has already been a fall, it's very easy to say, well, remember when you already fell? All I'm trying to do is just help you not to fall again, right? Well, that isn't necessarily a tone that a person might be receptive to, right? Maybe we can start off by saying, you know what, that last fall that you had really had me worried. And I've been thinking that let's discuss this a little bit more. Let's find a way to avoid another fall. So, really, the tone and how we start the conversation is as important as the information, as the actions to prevent these risks for falling. And so, always try to highlight that this conversation is happening to prevent an accident. Next slide, please. So, as I mentioned, I am going to give you some examples of conversation starters. So, this one, the first one that you see on the screen there, is showing that you care. So, the person might say, you are important to me. I know that you want to be independent and stay in your home, but I don't want you to fall and get hurt, right? I'm showing that I respect the person. I'm showing that I care for them. I care for their safety. So let's have a conversation to avoid a fall, right? The next bullet point that you see there is a little bit more focused on prevention, right? So being active will help you feel better and stay independent, right? So if you notice that someone maybe is a little too afraid to move because they're afraid they're going to fall, or maybe they really don't want to go out, they stop their walks that they had with people or their movement, we can always try and approach this as prevention, right? Hey, you know what? I noticed that you stopped going out on your walks, but really I've been reading, and being active will help you feel better and stay independent for longer, and avoid a fall, right? So again, focusing a little bit more on the prevention side of things. Next slide, please. This next one is also focused on prevention. So, hey, you know what? I was reading that you should get your vision checked by an eye doctor every 1 or maximum 2 years, to see if there have been any changes to your vision. I know that you use glasses to read. When was the last time you went to get your eyesight checked, right? So you can start with the prevention, with I learned this, and then showing interest, curiosity. This is something that I cannot tell you how often I hear when people, don't really go and get their eyes checked. And maybe they just are using the glasses that are their spouses, or they just, got it at their checkout at the store. So it is important to make sure that you are paying attention to your vision, any changes to your vision or the vision of the person that you care for. You might notice that as well. So, all in the hopes of prevention, of preventing a fall. Um, and the last bullet point that you see here is more on the helping side. And of course, all of these are to help, right? But maybe encouraging them that you want to help, you want to be active in helping them. So you can always say, hey, you know what? Let's sign up for a Tai Chi class. Let's do it together. I've heard that Tai Chi is like a mind body exercise that can help improve balance, is very gentle. It really promotes mindfulness. So really you can use this as a way to involve yourself, help them, and really also do it for yourself, not just the person that you're caring for. So these are just some ideas of how you can start a conversation to encourage people to be safe. Next slide, please. So now maybe we identified some things. We've identified maybe some risks that our loved ones might have. We have started the conversation. All right, yeah, you know what? Let's develop a plan of action, right? That would be the next natural step. This would be the natural progression. So developing really a plan of action for yourself or for those you care for is super important. You can do a home safety assessment. Of course, you can do it yourself. You know your home or the home of the person that you care for. You know their home, you have an idea, but sometimes we don't have all of the information. So you can have a professional come in and do a home safety assessment. Well, they'll, for example, they're going to the restroom, they'll check it out, they see what are some of the risks and also what are some of the recommendations that they will make to prevent a fall. You can also talk to your healthcare provider that you have some concerns, that you notice that the person that you're caring for maybe is leaning a little too much on the furniture around them. So what can I do, right? Who can you refer me to? Is there a service that I can go to? So always making sure that this is communicated to the healthcare provider. Um, they may have some recommendations, especially if the person that you're caring for has a condition that affects the way that they move, or their mobility, their balance, right? So you want to still make sure that they are being safe while they're moving. And of course, A plan of action, ideally, besides assessing the home and everything, should include uh, physical health, right? Physical activity, movement. But again, we want to be safe in this process. And of course, this is only if it is possible. If the medical provider has already stated that movement or exercise is not recommended, but maybe physical therapy is, then this will roll into the plan of action. Anyways, whatever it is, physical health, movement, careful movement is important in this plan of action, right? Making sure that we are able to do our activities of daily living is making sure that we are able to move around our home, or for our loved ones, their home if they live separately, and making sure that we're in the course of those actions in that movement preventing a fall. Next slide, please. So let's go a little bit more into home safety. We will be discussing home safety in the bedroom, in the kitchen, outside, stairs and hallways, living room, and the bathroom. Now, of course, I have already mentioned some of the recommendations, and some of them that apply to all of the home would be reduction of clutter, right? Having adequate lighting, but we will go into detail into other things. Next slide, please. So let's start with the bedroom. Um, we should probably have a light source next to the bed. And this is because, yes, we may have a ceiling light, but what if the switch is far from our bed, right? Or the person that we're caring for, their bed. So we want to have a light source that is easily accessible to them next to the bed in case they need to stand up in the middle of the night. They have lighting right away. We want to make sure that we're checking all electrical cords. One, to make sure that they are working well, that they are not peeling, that they are not in some way damaged. We want to have that safety, but also that they're not in the middle of walkways, hallways, that they're not loose. We want to always make sure that the electrical cords are ideally together and fastened to the wall, that they're not in the way of where the person is walking. And again, a professional can help you assess this and even give you further tips to the specifics of your home. Also making sure that the closet is easily accessible, that they don't have to move big doors or any furniture to access their clothing, that the contents are reachable. Some closets are wonderful, they're very big, but sometimes things are way in the back. So we want to make sure that things are reachable. Additionally, that the bed is proper height. This is a big one. A lot of the times we see the bed being too low or too high. Either way, it could be a risk for falling. So making sure that we're assessing that the bed is proper height, that it's not a big effort for them to either go onto the bed or off of the bed. And if assistive devices need to be used, like for example, an electrical bed where it goes up and down, or more of a hospital bed, which some people need, making sure that we are being safe with all of that. Another thing that might be very helpful, especially for those older adults who may have some mobility issues, to keep them safe from falling, is to have a chair in the room that they can use when they are dressing or undressing. It is important to consider that some of them may, they may have low energy. Dressing, undressing without being sat down can be challenging. So making sure that we have something for them so that they feel safe and comfortable, and that we're preventing a fall. Next slide, please. The bathroom. The bathroom is a very big risk for falling. So we want to make sure that we are as safe as possible. Why is it a big risk for falling? Well, Because usually we are handling water in the bathroom. Sometimes the tile can be slippery, or the bathtub can be slippery. So we want to make sure that we are taking precautions. If we have a glass door, and the person that we're caring for has some vision issues, we may want to place some colored tape on those glass doors so that they can see where they are, right? That the depth is there, that they notice it, that they don't walk into it and then fall, right? That can be a very, very, nasty fall that can cause injury. So maybe placing a tape so that it's more obvious to them. Having the furniture, toilet, and counters a different color than the floor. This can also help with the depth perception. Um, and of course, installing grab bars as needed. The grab bars need to be placed, I would say, by a professional or at least someone that knows how to fasten them, because you can have the handlebars, but if they're not properly installed, that can be a risk factor. So making sure that the installation of the grab bars is done correctly, placing non-skid mats wherever they're needed, but that they're safely placed, that they're properly placed, and then a bath seat as needed. Sometimes the toilet can be too low, or the shower doesn't have a place for the person to sit. So having some type of assisted device that can make using the toilet or showering easier and safer is the way to go. So again, bathroom, very big area where we want to see and assess if there are any risk factors there. Next slide, please. So the kitchen. For the kitchen, about this in different ways, not just as a risk for falling. Of course, we want to make sure that any sharp items, anything that might cause a trip, a slip, a fall is secured or paid attention to. But also, if the person is dealing with cognitive impairment, there's some type of memory loss, Alzheimer's, or another form of dementia, that we are also taking extra precautions to prevent just any type of risk in the kitchen. Because, for example, if there's loose clothing being used and their balance is off, they may become tangled in something and fall. Or, for example, if we have the stove on, and again, if it's hot, if they leave it on because there's a cognitive impairment and they, for some reason, they touch it, that can lead to a fall. So the kitchen is also an area where it's tricky, and we want to pay special attention to, not just for the risk of fall, but in general for the risk of injury, right? Because a fall can cause so many injuries in the kitchen. So we definitely want to make sure that we are paying special attention to this area. You might see also disguising garbage disposal. Well, that might not necessarily cause a fall, but it might cause a big injury that might cause a fall, right? So a lot of these are kind of secondary to the fall risk. Next slide, please. Living spaces, general living spaces, right? Living room, dining room, etc. So again, the electrical cords, making sure that they're away from walking paths, that we are arranging furniture in a way that it's not blocking walkways, that there's enough space for people to move around, making sure again that the sofas, the chairs are the right height, that they're not wobbly, that the person that you are caring for can get into them and out of them easily. That commonly used items are at waist level or within easy reach. This will prevent the person to try to go on a little step stool, or very reaching very forcefully. This can prevent a fall. Maybe instead of having a stool, right, maybe we can have a reach stick handy. Or if they need help, really communicating that with them. If you need something, come and get me, right? So again, this can prevent a fall. And then Something that not everybody has pets, but we do have a lot of older adults who have pets as companions, whether it be a cat, a dog, etc. So just being aware of where they are so that we can avoid tripping on them. This can be, this can cause injury to both the person and the pet. So maybe having some type of bell, some type of alert that will tell us where our pet is so that we can avoid a fall this way. Next slide, please. In stairs and walkways, these are also a big risk for falling. So making sure that we have handrails installed. If we don't have handrails, that we install them correctly, that we hire someone who knows how to do that correctly. The good lighting on the stairs and walkways is very important. Something that we can do besides the ceiling light that we might have, because you may not be able to have a lamp on your stairs or the walkway, is that you can have floor lighting, right? You can buy those strips that stick to the floor, put them in the edges, and they'll signal the walkway or the stairs. So these are different devices that we can use to assist and provide good lighting. um, Again, making sure that areas are clean, they're tidy, that the carpet isn't loose, and that if we are using rugs, that they're secured, and really that we're very careful in choosing which ones they are and where they're going. Next slide, please. And outside, right? I already mentioned the outside. If there are steps, make sure that they're in good condition, that they're even. If it's concrete, that it doesn't have cracks. If it's wood, that the wood isn't rotten, where it becomes risky that their foot might go through the wood. Adding non-slip materials to steps. And maybe the non-slip material that is very obvious, not the one that's dark, that kind of blends in, but having a non-slip material that is there for the person to see and notice and be aware of. Keeping the lawn, deck, or porch areas clear. Consider installing grab bars near the front door to provide balance while locking and unlocking the door. You can even put a sturdy chair as well, but making sure that we're being precautious in how we're assisting the person when they go in and out of the house. And then leaving the porch light on in case we return home when it's dark out. How many of us have left home when it's light, and then for some reason we come home and it's all dark, you can barely see? So imagine having to do that while you're taking care of the person, or the person is, maybe they're still on their own and having to deal with that. So really encouraging them to, let's just leave this light on all of the time. So making sure that there's enough lighting outside as well. Next slide, please. So really what we want to do now that we've gone through the areas, that we know the risk factors, is we really want to communicate with the healthcare provider. We want to make sure that we're discussing current health conditions, how they're affecting mobility, how they might affect a risk for falling, scheduling yearly hearing and vision checkups at the very least, because the provider might actually say, hey, you know what? You need to get a vision checkup not in a year, but actually in 6 months. So making sure that we're communicating that we're aware of those checkups, monitoring medications, making sure that we're aware of the side effects. And if the side effects are happening, we communicate with the medical provider. Implementing a good sleep routine can do wonders. I know that sometimes when we are caring for someone who has a cognitive impairment, the sleep routine is a big challenge, but even for ourselves, right? Making sure that if we're caring for someone and I know I'm sleep deprived, my vision is already becoming blurry, that I ask for help so that I can have a good sleep routine so that it's not a double risk of fall. And discussing behavior, right? Just general behavior, any behavior that you might think is risky or that might cause a fall. Let's talk about it. And this can be, sometimes people listen more to the doctors. And if you need to enlist your doctor to help out with this task, let's do it. Okay, so these are some of the recommendations that we can do to help prevent falls. Next slide, please. And I did mention physical health throughout the presentation, and I'm going to do it one more time. It is important. And if you are a caregiver and you're still maybe in your 20s, 30s, 40s, whatever your age, making sure that you're also prioritizing that physical health in whatever big or small way you can. So one of the ways that we recommend here is limiting consumption of alcohol, right? If you notice that you're going to alcohol as a way to relieve stress, well, let's find something else. Let's find a physical activity that can help you relieve stress. If you if you notice some habits that you know are not promoting any type of health benefit, then let's quit those unhealthy habits, right? Let's see what our options are. Making sure that we're nourishing our body, that we're not just eating to feel full, but that we're actually looking at what is nutrition, what is giving me energy, what makes me feel a loss of energy, or maybe lazy, or maybe like I'm crashing, right? We hear that often. So making sure that we're consuming healthy meals, that we're stretching in the morning, even if it's a 5-minute stretching routine. If that's all the time we have, that we do it consistently. Maybe that we're taking walks. If we have 5-10 minutes, maybe just go outside, do a very small walk, just movement in general. If you have the time, join a Tai Chi group, a yoga group, right? As a caregiver, you need to take care of your physical health. And if the person that you're caring for is still able to join you in any of these, then why not? Next slide, please. And last but not least, I always want to encourage anyone joining us today uh, uh, to learn about our services. If you're not familiar with who we are, here's a little snapshot, sorry, of who we are. We are Southern Caregiver Resource Center. Our services are free and they're there for family caregivers. We have family consultants that are there to make individualized care plans for family caregivers. We have support groups. If you're not ready to do a support group, you rather do a one-on-one, we do have that individual counseling available to discuss anything related to your caregiving responsibilities or tasks. We also have legal and financial consultation if you don't know if the care receiver qualifies for certain services, or all of a sudden you're in charge of their financial situation and you have questions, we have this option as well. We have our education and training department, which really we try to have as much information out there and available in the easiest way possible to access. We have our TLC and Calma programs, which I will talk about in the next slide. We have specialized information, respite, and a lot of online resources, which I will also talk about in a couple of slides. But in a snapshot, these are the services that we have for you, and they are all free. Next slide, please. Going into our TLC. So our TLC program is there for the family caregivers who are caring for someone who has memory loss, Alzheimer's, or another form of dementia. And this program is evidence-based, and it really provides the caregivers with strategies to cope with the stress, with managing difficult behaviors, difficult situations. And really, these are techniques that we know work, that help you avoid isolation. They can help you come back from a crisis. They can really help you focus on self-care. And, self-care might be part of your physical health, right? To avoid falls. So we're tying all of this together. So if you're interested in these free classes, give us a call. Next slide, please. And I had mentioned we have a lot of online information. You can find all of this in our iCare portal through our website. www.caregivercenter.org. You can find our Caregiver Corner, which are quick tip videos. They're very short and they give you some tips. We actually have quite a few related to avoiding falls. So you might want to check that out as a way to supplement today's presentation. We also have a podcast called Let's Talk Caregiving, where each month Marta and Roberto, which are the podcast hosts, discuss things related to caregiving. They have different guests. So if you are a busy caregiver, which I know all of you are, the podcast might be an easy way for you to just listen while you're driving or going to doctor's appointments or taking care of caregiving tasks. We also have a lot of these family classes, these caregiver classes. We have them on Facebook, on YouTube. We have one of these every month. So really, if you have an hour every third Wednesday of the month or another time of day, you can always watch these. Or you can also sign up to our digital newsletter. That's an easy way to see what's going on with us, who we collaborating with, what is going on, what activities are happening in case you're interested. Next slide, please. And, if you are a social media person, you can also connect with us. Like I said, we're on Facebook. We also have our Instagram, and we do lives on our Instagram to give you information. You can connect with us via LinkedIn. You can see who's in our network, establish connections. Again, a lot of these videos are in YouTube, so you can really browse through our selection there, and our podcast, of course. Next slide, please. And for any questions, if you don't know if you qualify for our services, or if you want to learn more about the TLC program, you can go onto our website, www.caregivercenter.org, or you can call us toll free at 800-827-1008, or our regular number is 858-268-4432. You can call us at our regular hours, which are Monday through Friday, 8 in the morning to 5 in the afternoon. If you are calling us in a holiday or outside these hours, you can leave a message, or you can also send us a message via our website, whatever works best for you, but we will return your call within 24 to 48 hours. So just leave your contact information. Again, reaching us is very easy. A lot of the times people tell me, I wish I would know about you sooner. So here is your chance, and I hope you learned something today. See you next month. Thank you so much.